Patient's name is Tommy Johnson, 10-year-old male. Chief complaint is I have asthma and it is getting worse. HPI, Tommy's mother reports that for the last week, Tommy has been coughing, wheezing, and complaining of being short of breath at least once a day, but albuterol does provide some improvement in symptoms. Tommy reports exercise makes symptoms worse. His cough occasionally wakes him up at night. He denies fever, productive cough, nausea, vomiting, or any other symptoms. Home medications are albuterol 2 puffs as needed for wheezing and shortness of breath. Past medical history only is asthma. Allergies, no known allergies. Past surgical history is none. Family history is significant for COPD. Social history, mother reports the home is smoke-free, denies any history of violence, drugs, or ETOH use. Mother reports Tommy is involved in school activities and basketball. Negative review of systems regarding general, skin, eyes, ears, nose, mouth, throat, heme, lymph, endo, GI, GU, musculoskeletal, neurological, and psych. Positive review of systems regarding cardiac. Patient reports he feels dizzy at times when his asthma is bad, but he has never passed out. Respiratory review of systems is per HPI. Physical exam and vital signs. Weight is 68 pounds, BMI is 15.2, height is 4 feet 8 inches, temp is 37 degrees Celsius, pulse is 88 and regular, blood pressure is 100/70, respiration's 30, pulse ox is 92% on room air. Tommy is a healthy appearing male in no apparent distress. The respiratory exam is expiratory wheezing heard in all lobes bilaterally. Chest wall is symmetric without deformity. Physical exam is otherwise normal. Differential diagnoses include an asthma exacerbation, moderate persistent. Moderate persistent asthma consists of symptoms occurring daily, including nighttime wakenings 1 or more times a week, but not daily. SABA use daily, some limitation to normal activity and lung function with a predicted FEV of 60 to 80%. Second differential is bronchitis. Bronchitis involves inflammation of the airways causing mucus production. As the airway constricts, wheezing can occur, and that leads to shortness of breath and a cough, which this patient has some of these symptoms. Third differential is pneumonia. The classic signs of pneumonia include fever, wheezing, cough, and difficulty breathing, which again, this patient has some of these symptoms. Diagnostic studies include CBC with differential, which was within normal limits. EKG with 12 lead was normal sinus rhythm with no PVCs present. O2 SAT pulmonary function study was 77%. Final diagnosis is asthma moderate persistent. A characteristic of asthma is a hyperresponsiveness of the airway to a variety of stimuli, including allergens, exercise, cold air, or an infection. This hyperresponsiveness results in bronchospasm, which presents as wheezing, breathlessness, chest tightness, and/or cough. Plan and care include for medications, administer 2 puffs of albuterol now, and after 5 minutes repeat the PEF and document. Home medications continue albuterol and start inhaled corticoid flunisolide aerosol solution, 80 mics per spray, to be dosed at 2 puffs every day for a total of 320 mics per day. Non-pharmacological recommendations include avoiding exposure to allergens or irritants, warming up before exercising for 5 to 10 minutes, consider doing a sweat test as an additional diagnostic test, patient education to include an asthma action plan, include current classification of Tommy's asthma, include common asthma triggers and preventative measures, correct use of PEF to monitor treatment plan progress, include medications, instructions on correct use of inhaler, include what to do if patient becomes unstable, cultural considerations, interventions should be aimed at prevention and addressing any inequalities, consider allergy and pediatric pulmonary referral, follow-up in 48 hours for evaluation, 6 months for another evaluation, and make sure to include a control questionnaire.